So thank you so much for the opportunity to be here with everybody in the room and in the virtual world as well. I am a little bit newer to the uses of IDELA, so my stories are going to be not as in-depth, but I think my key message here is to again illustrate what a powerful tool IDELA has been for us in terms of, and we navigate the world of research, advocacy, as well as policy. So we're going to take a quick world tour through our different sites and projects across the globe, where I think we're going to illustrate some of the principles that were introduced by actually both Joan and the rest of the team as well. I also will credit our funders accordingly, but I should say that the Jacobs Foundation has made possible my particular work and partnerships across the globe in these projects. So we're going to start in Latin America. One of our primary interests has been to actually bolster the literature and the research on impact evaluations of early childhood development programs, and we've been working primarily in Colombia in the past few years. So I'm going to add one more actual goal that I think from the list that Lauren shared with us, and it's shifting paradigms. I think IDELA and tools like IDELA have been helping us shift the conversation towards one that's been more historically really afraid of sort of assessing outcomes of children, not to test the children or teachers or their performance, but actually to let us know as programmers how good of a job we're doing and how good our policies are. And I think that's a total change in paradigm. And I think that it wouldn't be possible with tools like IDELA, and it's really helped us sort of break ground globally. And this has been particularly the case in Latin America. It's been very important for us. In Colombia, and this is in my particular sort of scoping of the literature and knowledge of the country, assessment has traditionally been very formative. So it's not like assessments are not used, but they're very much in the realm of sort of helping teachers adjust their practice, which is it's fine, it's a good goal to have. But there's a very infrequent use of direct assessments, and for those of us who really navigate the world of assessment, we know the importance, the different purposes of these types of assessments. So for example, direct assessment is important for us to let us know how we're doing as a program and eventually to inform policy, something that a formative assessment cannot do as well. So this, I think, has been partly responsible, this lack of tools like IDELA, for, in many cases, lack of solid, good impact evaluations. So this is really helping us as researchers and as practitioners to fill a research and a policy and a practice gap that we've been going through. So one of our partners in Colombia is a program called Pisoton. It's a psychoaffective program. Psychoaffective is the actual Spanish translation, and it really taps into the idea of bolstering psychosocial and social-emotional skills in children, and it targets ages 2 to 9. It's been widely implemented in Latin America for many, many years, and it's targeted primarily to vulnerable/fragile contexts. So it's a really interesting intervention. It's sort of an add-on to an early childhood program, but it really, again, is focused on social, emotional, and psychosocial development. Despite its historical and immense scale, it has never been to date robustly, I would say, evaluated. So there's been a tremendous amount of qualitative, very interesting evaluations of this program, but nothing yet to date that would actually let us know what the actual impacts are of this program on beneficiary children. So again, breaking ground, shifting paradigms. This is the first time that this program has actually used a direct assessment for its for its evaluation. So we've just completed with our partners a pilot evaluation in 7 regions of the country. So it has a really interesting geographic diversity. It's pilot because it's a rather small sample, but this is again just in the spirit of trying to understand how IDELA is working, what adjustments it needs to be made, and it's extremely exploratory, right? So I told you that this program focuses on psychosocial, social-emotional development, but the programmers are interested in researchers in understanding what other domains of development could this be affecting. And so this is also when something like IDELA, that is multi-domain, has been extremely useful. So the analyses are ongoing. IDELA was adapted for the first time in Colombia in 2015 after a training that, say, the children led. Again, it's allowed us to look at and explore multiple outcomes of this particular intervention. So far, we can say that we are hopeful that it actually does demonstrate sensitivity to program impact, and we're hoping that the report for the impact evaluation is going to be coming up in the next few months. I need to credit our partners who have led this work at Universidad del Norte, the principal investigator, Anrita Russo, and of course the technical support for Save the Children. Now we're going to go to a second country in Latin America. So the purpose is similar as well. We actually are using it. We're using IDELA as our key outcome of interest. And this is very interesting. We're talking also about collaboration and comparability. So we have partnered here with, which I'm sure you have heard of, most of you in the audience, of the Mother Child Foundation in Turkey, who has historically implemented very powerful programs around the world. So Brazil has adapted two of these programs. They're school readiness programs. One is a mother support program and the teacher support program. And they've adapted these Turkish programs into multiple contexts. So a tool like IDELA is allowing us to see, okay, how is this adaptation process working out in terms of propelling certain outcomes in children, which is ultimately the goal of the programs themselves. So we have partnered with local researchers also to conduct a program evaluation, and this was done in a representative sample of public preschools in the city of Embu in the state of Sao Paulo. It's a larger evaluation with 900 child and mother dyads who were randomly assigned to both intervention and control group. IDELA, again, is a key outcome of interest. This is a time IDELA came when this group of researchers were looking for something that was adaptable, holistic, that was open source, and that had strong psychometric properties. And again, this is where IDELA fit the bill. And that's why our team decided to go with this particular tool. The research is also in progress, so hopefully my talk is getting everybody excited to continue to tune in. Because these are literally ongoing as we speak. But again, if you think about the fact that this was open source just 3 years ago, and the power that it's given us as partners international is extremely important. And I think this again taps into that purpose that John was mentioning, which is we need to be able to know what good of a job we are doing as programmers. And so that's how we are using it in our research globally. The partners in Brazil must be credited at the University of Sao Paulo. Principal investigator is Dr. De Rosario, and the funders for this particular project are the Bill and Melinda Gates Foundation. Now we're going to go to the Middle East. We're going to go to Saudi Arabia, and this is the most recent work that we have been engaged in. Interestingly, this is also an adjunct program, so you can start to see a theme here, right? So as technical partners, eventually I think we are going to be asking questions about cross-country adaptation and impacts across different contexts. So something like IDELA might enable us to an extent to make these cross-country comparisons and questions if they emerge. As they emerge, our partners there are the National Safety Family Program. This is again just extremely recent. We just adapted, and the piloting is in progress as we speak. But the aim is to actually conduct a clinical randomized trial in Riyadh, the first one of its kind for MOCHEP, which is a program under evaluation. Although it's been again implemented for many, many years, it's the first time that this has been done. And again, IDELA being the primary outcome of interest to look at multiple program impacts. And then we're going to end up in Southeast Asia. And this is, I would say, one of the most exciting projects I've been engaged in the past few years. It is a project led by Dr. Aisha Yousafzai, and it is the Youth Leaders for Early Childhood Assuring Children Are Ready to School program, or the LEAPS program for short. It's the first of its kind in that it's a cross-generational strategy for school readiness of children from 3 to 6 years of age. But we're actually working with youth leaders in the community, female community youth leaders, who undergo a 1-month basic training for early childhood care and education. And they are selected to participate in a vocational program, as well as become part of a very active mentorship program. So we're really targeting both the youth and the early childhood communities in this project. We just finished our program evaluation. It was a cluster randomized controlled trial with 170 children at baseline in both the intervention and control arms. We used IDELA, but we also actually complemented IDELA with an executive functioning battery, specifically to test inhibitory control, working memory, and cognitive flexibility. We're excited to report, and we're hoping the paper will also come out by the end of this year, that the children in the intervention group actually scored higher than the children in the comparison group across all domains. This probably doesn't tell you very much, but I can tell you from a researcher perspective, it's important for many reasons. One, it tells us about the efficacy of our project. Two, it's an incredibly important tool for our funders. And three, it's an incredibly important tool as we try to transition to scale. This is the way to go. So I cannot say enough about the utility of this data for our partnerships and our particular work. So again, Dr. Aisha Yousafzai must be credited as the principal investigator, along with Munira Rashid. This is done in close partnership with the National Commission for Human Development in Pakistan, which is our government agency partner, and we're being funded by Grand Challenges and UNICEF for this particular project. So that is my world tour of the work that we've engaged in, how we're using IDELA across different contexts for slightly different but very almost similar reasons, although this is right now very practice and research oriented. Our ultimate goal is always to mobilize policy and to improve quality, and we believe that this evidence is really enabling us to do that. So that's where I'm going to end.